So first I'm gonna put some hand sanitizer on your mouth, and then I'm gonna open up the chucks, only touching the blue edges. Laying that out on the table. And then I'm gonna go ahead and start opening my supplies. First I'm gonna put that there. And then just open them up, making sure I don't touch the pads. Open and dump. Open and dump. And then I'm gonna take my ABD pad and open it. Open and dump. And then my tongue blade. Gonna open it and then grab and dump. And then same with the cotton tip applicator. Open it, grab it, and dump. And then my gauze roll. Open and dump. And then I'm gonna grab my tape and rip 2 pieces off, hanging them on the edge so they're clean and I can just grab them right away when I need them. And then I'm gonna go ahead and grab this and first just wipe it on the blue edge to get rid of any contamination. And then I'm gonna go ahead and put it on the tongue blade without touching it. So I'm just gonna kind of slide it back and forth, getting enough on there without touching it. Then put that to the side. Then I'm gonna go ahead and open up the saline and pour some in my basin. All right, and then I'm gonna go ahead and put my hand sanitizer on again and then welcome my patient into the room. Can go ahead and have a seat.
Okay.
So at this time I would do any treatment that needs to be done to her wound, modalities, irrigation, debridement, modalities doing it last, and then I would go ahead and start doing her dressing change. So hi, I'm Abby.
Hi.
How are you doing today? Put hand sanitizer on again. So first, I'm gonna go ahead and put my gown on for treatment. And then make sure it's tied securely in the back. And tie the second one. And then before I would have put my gown on, I would have put these 2 chucks under her arm, and then I would put my gown on, so I'm just gonna do that now. Again, only touching the blue. There we go, and then I'm just gonna put one more, and then you can put your arm down. Only touching the blue edges. All right, good, and then you can go ahead and put your arm down. And then I would have put my gown on, and then I'm gonna go ahead and put my mask on. Putting it on and making sure I bend it to my nose. Oh. Making sure I tie it. Try not to tie it in with my hair. And then make sure you tie the bottom one too. It smells like a dentist. And then forming it to your nose so it stays on correctly. And then hand sanitizer again. hand sanitizer again because I touched my mask. And then air them out and go ahead and put your gloves on to start your treatment. Alright, so your wound is looking really good. The first thing I'm gonna do is just irrigate your wound. So just rinse it out with some saline here. Does that sound okay?
Yep.
Alright. So there we go. And then I'm just gonna dry it off with this pad. And then I'm gonna go ahead and take this wet one, so you can lift your arm up. And then throw that in the garbage. And then next I'm gonna take the cotton tip applicator and take the ointment and put it over the wound. And then I'm gonna go ahead and dip this and wring it out a little bit just so it's not soaking wet. You just want it a little bit wet. And then put that so it covers her wound there. And then go ahead and take the AVD pad and put that over it so it fits nicely. And then you're gonna go ahead and take your roll and put it a little above and a little below so it stays on correctly. So just gonna go ahead and wrap that and then doing the little method there so it stays on nice and snug. How's this feeling?
It's good.
Okay, good. And then, so I'm making sure you wrap it a little above. Then there's extras, so you can just kind of wrap it around to make sure it stays on nice and firm. A lot of extras. Good, and then I get to the end here, and I'm gonna grab my tape and go ahead and put that on. And put that on, another one on, just so it stays on nice. And there you go, so that should stay on for a little bit. How does it feel?
Feels good.
Good, all right. If you have any questions, please let me know. Do you have any now? All right. Sounds good. And then now I'm gonna take off my gloves first, not contaminating anything else. And then put them in the garbage. Then I can go ahead and take off my mask. And then throw that in the garbage. And then same thing with my gown. And then take that off, trying not to contaminate yourself by wrapping it up, throwing that in the garbage, and then finish off by doing some hand sanitizer. And that is how you do a clean technique dressing change.